Hi friends, welcome to Dia's tutorial. In this video, we are going to see about the fracture of the shaft of humerus. First, we will know about the general anatomy of it. So before going into the video, if you have not subscribed to my channel yet, don't forget to subscribe it. The shaft of humerus is round in the upper part and it is somewhat triangular in the lower half. The shaft has three border and three surfaces. The three borders are the anterior border, lateral border and the medial border. So consider this is the anterior border, lateral border and medial border. Now we have three surfaces, right? The surface between the anterior and the lateral border. The surface between the anterior and lateral border is the anterior lateral surface. Okay, this is anterior lateral, and the surface between the medial and anterior border is the anterior medial surface. Okay, and the behind and the posterior side we have the posterior surface. So these are the three surfaces. Then the deltoid will have the insertion in the deltoid tuberosity. All the three fibers of the deltoid will insert into deltoid tuberosity, which is on the anterior lateral surface. It lies on the middle part of the shaft in the anterior lateral surface, and posteriorly there is a groove where the ulnar nerve will pass. And this is about the general anatomy of the shaft, and the shaft is covered by many muscle groups like the biceps, triceps, brachialis, coracobrachialis, etc. As there is a muscle bulk covering the shaft of the humerus, the compound fracture incidence will be low, which means compound fracture is nothing but a open fracture where it penetrates through the skin and comes out. So the incidence of compound fracture is low and it unites earlier. The union will be early because it is supplied by a rich blood supply. The muscles will get rich blood supply, so that the union will be earlier. The fracture segments will unite earlier. Even if the malunion occurs, if there is a malunion also, this will be masked by the muscle group. The muscle, because of the thick muscle cover, the malunion doesn't matter that much. And this fracture can occur at any age, no matter if it is a children or an elderly person or even an adult. And it is caused either by a twisting or a bending force. When there is a twisting or a bending force acting on the humerus, the fracture may occur, and also because of a fall on a outstretched hand, or even if there is a direct injury to the arm, direct force to the arm. These things causes the fracture of the shaft of humerus. The fracture of the shaft of humerus is a classic prototype. We say it is a prototype because all the type of fracture can be seen here. Okay, what are the types of fracture? Transverse, oblique, spiral, communicated, open, closed, everything will occur here. So this is the transverse fracture. Next is the oblique fracture of the shaft. Ignore this arrow mark, it is wrong, I have drawn it wrong. So the fracture is oblique. And then we have the spiral, where one segment rotates in one direction and other segment rotates in another direction. It is spirally. Then communicated fracture, where the bone breaks into more number of segments. This is the communicated fracture. And then we have the segmental fracture. Here the bone will break into a separate segment, so will be a separate segment. Okay, so these are all the types of fracture occurring here, and these fracture can occur because of pathological factors also. And here the displacements are variable, like there will be a slight displacement, or in some cases there will be no displacement occurring. And overlapping of fragments may occur, where the two fragments of the fractured bone overlap. And then the angulation, marked angulation will be there, where the fractured segment will go into an angle. And the most common is the lateral angulation. This occurs because of the abduction. What muscle is responsible for abduction? The deltoid is responsible. So the deltoid will pull it into a lateral, the proximal segment into lateral angulation. And the lateral angulation increases when we try to keep our arm close to the chest. That is, during adduction, the distal segment will move this side and the proximal segment will move laterally. So this causes the lateral angulation. The fracture at the shaft of humerus can be diagnosed from the signs and symptoms itself. Using the signs and symptoms itself, we can come to know. But an X-ray will be needed, an X-ray of the whole arm, including the shoulder and the elbow. And we know that the radial nerve will pass through the radial groove we have seen in the anatomy. So if there is a injury because of the fracture, injury to the radial nerve because of the fracture, then there will be a wrist drop. So by this we can diagnose this fracture. Then if we come to the treatment aspect of this fracture, it unites very easily. The union is easy, and even if there is a slight displacement and a little angulation also, it is acceptable. Okay, because already we have seen that it is surrounded by a huge muscle bulk, so this will be masked by the muscle. And the other reason is the multi-axial shoulder joint proximally. As the humerus is, if you see the humerus, proximal joint will be the shoulder joint, and distally we have the elbow joint, and the shoulder joint is a multi-axial joint. So because of that also, the slight displacement can be neglected. And the main aim of treatment is the pain relief and the prevention of the lateral angulation and the distraction. So the treatment is done on these factors. And in conservative method, we have used lab, hanging cast, chest arm bandage. We have the operative method also. First we are seeing the conservative method about the use slab. Here the slab is nothing but a plaster only. So thick plaster we can see. So it starts from the neck, bottom of the neck, and from the neck it passes through the lateral side of the arm and then to the elbow, below the elbow joint, and then it finally reaches the medial side of the shoulder. And this slab is supported by a triangular sling. The slab is removed after 6 to 8 weeks and the mobilization exercise will be started. Then we have the hanging cast. This cast is given if there is a fracture at the lower half of the shaft of humerus. Okay. The weight of the arm and the weight of the cast will provide a traction, downward traction, so that it will be in a correct alignment and it is supported by a triangular sling. And the chest arm bandage will be enough to give immobilization for the fractures in children. This is enough for children. When reduction with the closed manipulation or the fracture is unstable, we go to operative method, that is the open reduction and internal fixation will be done. And the fracture is fixed using the plates and screws. One of the methods similar to plate and screw method is the intramedullary nailing. It is also one of the procedure. Complication of this fracture includes the radial nerve injury. It is generally a neuropraxia, which means the nerve injury is not that severe. Okay. And a special type of fracture known as the Holstein Lewis fracture, where it is a spiral fracture. It occurs at the junction of the mid shaft and the distal shaft. So here the fracture occurs and it results to the entrapment of the radial nerve. Can you see the radial nerve is between the fracture segments. So this leads to the paralysis of the wrist, fingers and thumb extensors, brachioradialis and the supinata, and there is also sensory change in the radial side. The next complication is the delayed and the non-union of the fracture segments. This delayed union or non-union will occur more commonly when there is a transverse fracture at the midshaft. And the causes of this non-union is the inadequate mobilization and the destruction of fragments because of gravity. So this is it friends. I hope you all would have understood it. If you like the video, hit the like button, and if you have not subscribed to my channel yet, don't forget to subscribe it. Thank you for watching the video.